Good day, sir. My name is Gastrointestinal. I am a student nurse from PMC, and today we're going to assess your systems. Can you please state your full name and birth date, sir?
Michael Anthony B. Garcia on July 13, 2002.
Sir, can you state the date today?
March 30, 2024.
Can I ask you, sir, what did you eat earlier?
Chicken.
Sir, do you want to go to bathroom before we proceed our procedure? Sir, what are your reasons for seeking of care?
Check out.
Sir, do you have any question or concern before we begin? are the things that triggers your pain?
When I skip my meal,
Sir, what are the things you did to lessen the pain?
drink water.
Sir, can you rate the pain from 0 being to the lowest and 10 being to the highest?
5.
Peripheral and lymphatic system assessment. Informed consent and subjective assessment should be made first. We must position the patient to sit upright and examine from behind. Ask to tilt their chin slightly downwards to relax the muscles of the neck and aid in the palpation of lymph nodes, and also ask them to relax their hands in their lap. We must also inspect for any evidence of lymphadenopathy or irregularity of the neck, such as visible swellings or masses. Stand behind the patient and use both hands to start palpating the neck. Start under the chin for submental lymph nodes, then move posteriorly palpating beneath the mandible for submandibular lymph nodes. Turn upwards at the angle of mandible for tonsillar and parotid lymph nodes, and feel anterior for preauricular lymph nodes and posterior to the ears for posterior auricular lymph nodes. Then follow the anterior border of the sternocleidomastoid for anterior cervical chain down to the clavicle, then palpate up behind the posterior border of the sternocleidomastoid for posterior cervical chain to the mastoid process. Palpate over the occipital protuberance for occipital lymph nodes. Then ask the patient to tilt their head, bring their ear towards their shoulder each side in turn, and palpate behind the posterior border of the clavicle in the supraclavicular fossa for supraclavicular and infraclavicular lymph nodes. When palpating, we must assess that the nodes are not palpable or only minimally palpable, non-tender, soft, and mobile. When we notice any palpable enlargement, tenderness, or asymmetry, it may indicate infection, inflammation, or malignancy.
Sir, do you have any pain of your shoulder before we move your arm? Sir, can you please lower your trousers and your underwear to check your inguinal lymph nodes? Sir, can you please lay flat on the bed, sir? Assist lang ka, sir. Cardiovascular system assessment. So first thing I'm going to do is I'm going to perform subjective assessment. So I'm going to ask the patient. So sir, do you experience now chest pain, calf pain, edema, pain in your feet, or while you are exercising? Okay, so do you have history of cardiovascular condition? Okay, thank you. So next what I'm going to do is I'm going to inspect the face, the lips, and the low extremities of our patient if there's any sign of pallor or cyanosis. Pallor is different from his skin tone, and cyanosis is lack of oxygen in the blood. So I'm going to inspect. So as I can see in his face is normal, same as his skin tone. No sign of pallor or cyanosis. Also of his lips. And for lower extremities, I'm going to, is it okay to touch your feet, legs, sir? Okay. Okay. Thank you. So next step I'm going to do is inspect his neck for GVD, this angle, supine. We're going to position the patient in a supine 30 to 40 degrees. So I'm going to check the near of his clavicle, and I'm going to locate the biphasic pulsation. That is, there are two pulses, which is one and followed by the broad one pulses. So I'm going to check. I'm going to inspect through use of 10 light. The normal is should not above 4 centimeters. Here. Okay, so it's normal. So next I'm going to do is I'm going to inspect the upper bilateral and the lower extremities of our patient to check if our patient has smooth, the color, and the warm. So for the upper bilateral, I'm going to start in the shoulder through his fingers. I'm going to check the color. It's same as his skin color. And for the warm, of course it's warm because he's alive. Okay. Next is the lower extremities. Okay. Yan ako siya matataas kaya he's wearing a jogging pants. Skin is also same as his skin color, and warm is also normal. Okay, thank you. So next thing I'm going to do is I'm going to inspect the lower extremity for hair distribution if there's any sign of edema or deep vein thrombosis. So I'm going to check if there's any sign of edema. It's okay to touch, sir? Okay. I'm going to press. Okay, no sign of edema. Okay, so next I'm going to do is perform the deep vein thrombosis. So I'm going to use a measurement to see if his both leg is symmetry. Okay, 13. Okay. Also 13, so it's symmetry. So next I'm going to do is I'm going to palpate the radial, brachial, dorsalis pedis, and the posterior tibia of our patient. So is it okay to touch your hand, sir? Okay. I'm going to see if compare and if there's any pulses. Okay, your brachyle. Okay, your dorsalis pedis. Okay, and your posterior tibial. Okay, so they're all the same. So next step I'm going to do is to perform capillary test. So I'm going to press the nail bed of our patient. Is it okay to touch your hand, sir? Okay. I'm going to press and then refill. Press, refill. It seems normal. That's it.
Now, sir, I am going to auscultate your chest using stethoscope. In order for me to proceed, is it okay that I am going to touch the certain part of your body po? Okay. Okay, sir, as I also said, there's no any extra sound, irregularities, and it's all normal. Now, sir, I am going to measure apical pulse if there is any symptoms of cardiac disease. Is it okay to you, sir, that I am going to touch your chest? Okay, sir, as I examine, sir, there's no any symptoms of cardiac disease. Thank you, sir.
Perform subjective assessment. I will ask the patient if he is experiencing a abdominal pain. Do you experience a constipation, sir? How about po difficulty of swallowing? Nausea po. And how about po loss of appetite po? Okay po. Kailan po yung last time na dumumi po kayo, sir?
Kahapon.
Okay po. Sa pagdumi niyo po, nakita niyo po ba yung pagdumi niyo po if they have any blood present po or different color po? Okay po. Thank you po. Sir, pag po ba iihi po kayo, nakakaramdam po ba kayo ng sakit? Okay po. To perform the next procedure po, can you lift up po your t-shirt to see the symmetry? Okay. As I can see po, there's no any abnormal findings po in your abdominal. So next po, I will auscultate the 4 quadrants of your abdominal po. So ask a permission po to touch your abdominal po. Is it okay po? Okay. Is it okay po if I touch? As I observe po, there is no any abnormal findings po in your abdominal po.
So, sir, may I have your permission and I will lift up your t-shirt and I will palpate your abdomen. Okay, thank you. I observe there is no any abnormalities or masses. And thank you. As I checked your weight trend yesterday compared to now, there are no changes on your weight trend.
So, okay, sir, for today, we will be conducting a neuromuscular assessment. So, first, sir, may I ask do you felt any presence of headaches or dizziness? How about history of falling down or loss of motions? Or in the medical conditions po, do you have any histories in line with neuromuscular conditions? Okay, sir, so can you tell me the date today?
March 30.
How about where you are right now?
Hospital.
Okay. So, sir, we will inspect or perform an inspection in your eyes to see if your pupils are equal and reductive to light and accommodation. Okay, your eyes are equal and also it is reductive to light and accommodation, so it is all normal.
I'm going to assess your motor strength and sensation. So first, we're going to do the bilateral hand grasp. So sir, can you please squeeze my fingers for me, please? Okay, thank you. Sir, so we're going to do the upper strength and resistance. Can you do this for me, sir? Then i-push ka, sir, ha? So dapat mag-resist ka. Okay. Next, can you do this, sir? I-push ka, mag-push ko sa dapat i-resist mo. I-resist ka upwards, as ako ka doon. Okay. Now, we're going to do the lower strength and resistance. So, sir, I'm going to touch your thighs, sir, ha? So, pa-down ko like, mag-touch, tas imong i-resist pa ka. Okay, next. Ipa-brown ka, sir, tas i-resist na sir. Okay, then next, sir, kani, mong toes, dapat i-resist ni mo, mag-push down ko, ikaw pa-up. Okay. Now, we're going to do the sensation in extremities. So, sir, napoy cotton diri, tapos ako kang i-touch with the cotton. Kung ma-touch na ka sa cotton, you will say now.
Now. No. No. No.
Note any unanticipated neurological findings in symmetrical facial features, extremity movement, and speech, and obtain medical assistance. And obtain emergency assistance. Note unanticipated neurological findings in symmetrical facial features, extremity movement, and speech, and obtain emergency assistance as needed. So, assess fall assessment risk per agency policy.
Let's now proceed to our post procedure. So first is to assess the patient into a comfortable position and ask if there are any questions or clarifications regarding the procedures. So now I'm gonna get the patients into a comfortable position. Okay, sir, can you please sit down? Sir, are you now in a comfortable position? Sir, do you have any questions or clarifications regarding the procedures? Sir, thank you very much for your full cooperation and your full patience. Next is to ensure the safety measures before leaving the room. Before finally leaving the room, we should always make sure that the call light, the bed, the side rails, the table, and the rooms are all secure to avoid any precautions. After making sure that the side rails and everything are all secured, we will now proceed to perform our hand hygiene. It is very important to perform hand hygiene before and after the procedure for us to avoid any contact precautions or any contaminations. After performing the hand hygiene, we should document every findings and every assessment. And lastly, we must report any concerns and clarifications from the patient.